Hi everybody, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna, and today I'm talking about understanding lower limb pain. And we see a number of cases of lower limb pain every day. People that come in with pain in their leg, whether it's sciatica, they've got hip pain like bursitis, they've got arthritis in their knees, or something like plantar fasciitis in their feet. We're going to talk about those conditions today. I am the chiropractor at Tut Street Family Chiropractic in Kelowna. And at Tut Street, we're located at 2755 Tut Street, which is the corner of Tut and Raymer. And I've had my own clinic here for a year. Before that, I was in a group practice in Kelowna, and I've had mostly my own practices over the last 30 years. I've seen thousands of patients in my clinic for lower limb pain. So I'm going to share some of that with you today and what we do to help people with lower limb pain. My journey with chiropractic started over 30 years ago when I had knee pain. And so this is relevant to today's discussion because the knee pain was excruciating. And after a number of visits to our family doctor, my father took me to a chiropractor, and the chiropractor checked my knees. He found out what the cause of the pain was, and then he did treatments to help me. And that made a huge difference because after a couple years of suffering, I wasn't suffering anymore. I could walk and bend and kick a ball and play on the soccer field and do all those things without having any pain. And what happened was my level of accomplishment in sports went up after that. So basically, I was more successful at playing hockey. I could do other types of sports because I had the desire to do that, but I was being restricted by the knee pain that I was experiencing. So chiropractic made a big difference for me, and it was one of the major factors in deciding to become a chiropractor myself, and that's when I was a young teenager. So we see a lot of children for lower leg or leg conditions like knees and feet and sprains and strains and different conditions. But we see adults too and seniors that suffer from different types of conditions like arthritis and bursitis and need some extra support and treatment. So I want you to understand what lower leg pain is. And when someone comes in and they have lower leg pain, what I'm referring to is conditions like plantar fasciitis, like arthritis, bursitis, and tendonitis. Now, these itis conditions, they refer to inflammation of a certain structure. So, for example, with the plantar fascia, when there's plantar fasciitis, it means it's an inflammation of the plantar fascia. Or arthritis, arthro meaning joint, inflammation of the joint. Or bursitis, inflammation of the bursa. You get the idea. So, although arthritis or bursitis, tendonitis might be the diagnosis, we really want to know what's causing that condition. So what caused the inflammation and what caused the bursitis in the first place? And that's very important. Because if we can figure out what the underlying cause is, then we can do the right treatment to help the person with their condition. Now, the symptoms that affect these areas, like the hips, knees, and feet, are different. Most of the time when we have someone with hip pain, the pain is located on the outer side of the hip, where that bump is on the side called the greater trochanter. With the knee pain can be under the kneecap, on either side of the knee, or with the feet, it can be on the arch of the foot, but it can also be on the toe area or right in the ankle. So there's different types of symptoms that present based on the underlying cause. And the prevalence or statistics of these conditions are very high. Lots of people with foot problems, knee and hip problems, which affects their walking, their ability to work and do different things that they love to do. So now what can you do about lower limb pain? So footwear is very important for lower limb pain, because if you have footwear that's not supporting your feet, it can result in compensation in your foot and the alignment of your foot, the way your foot works. A good example actually for me yesterday was I wore a new pair of shoes to work, and after wearing those shoes, what happened was I got home and I had some foot pain actually in the arch of my foot. So because I had pain in the arch, I was wondering, what caused the pain? How did this happen? And what I realized is it was because I changed my shoes. I wore a different pair of shoes that caused pain in the arch by my toes, which is called the transverse arch of the foot. So that was causing quite a bit of pain. I had to wear slippers in the house, and that was just because there's some inflammation that was created from wearing the different shoes. Today, I've changed my shoes, feels better, and I don't want to continue to aggravate that. So if you've got a new condition because you're wearing improper footwear, that's important to address that immediately. Now, what I tell my patients that come in for orthotics is just wear the orthotics for 1 hour the first day, then 2 hours the next day, then 4 hours, then 8 hours. So basically what you want to do is double the amount of time every day that you're wearing the orthotic. And I would say the same goes for shoes. If you have a brand new pair of shoes, don't start wearing them full time right from the start, but wear them for about an hour the first day, 2 hours the next, and kind of break them in slowly so your foot has a chance to adapt to the new shoe wear. If you have poor shoe wear, for example, if you had a shoe for a long period of time, or if your shoes don't have very good arches, it's important to get the right footwear. Now, sometimes patients will come in with shoes like Converse, very flat Converse, or Vans. You've probably heard of those shoes with no arches. They're not good for the feet because when you have a very flat surface, no arch support, and you don't have a lot of cushioning, it's going to cause some foot problems. So I would highly recommend getting orthotics if you have Vans or Converse, or getting a different type of shoe to help support your foot. Then maintaining a healthy weight is important too, because sometimes when we're carrying too much weight, what can happen is the weight can stress out our feet. It can push the arches down. It can cause inflammation of the surface of the foot called the plantar fascia. And if you're carrying your weight more on one side than the other, let's say you're out of alignment and you're carrying your weight on the left more than the right, you're going to cause excessive wear and tear on the left side of the body versus the right side. This can cause breakdown of the knee and the hip and the ankle and the foot on the left side, and that can lead to conditions like arthritis, which can eventually lead to wear and tear, and then you can't use those joints. They're painful, they're stiff, they get kind of rusty, if you get what I mean. They kind of break down, and then you can't use them, and you may need a hip replacement or a knee replacement down the road, and we don't want our patients to have to get those. So really what we want to do is encourage the proper footwear, but also talk to patients about getting the right balance between the left and the right. And through chiropractic care, that can help balance the hips and get the weight distributed evenly. And then healthy habits to just keep the weight from becoming excessive, where it could affect your body and stress it out. Now, regular stretching and exercises are important too. So with regular stretching and strengthening exercises, some of the ones that I like to give are just simple stretches for the calf muscle, the ankle, the knee, the hip, but also yoga type of stretches that can really help, like the cat and the dog, thread the needle. These are common stretches I like to give, as well as strengthening exercises like planks for the hips, like extensions for the knees in the gym, like curls for the hamstrings to help strengthen the muscles in the legs. There's some other ones I like to give too, like using a ball to roll on the bottom part of the foot, or even bands like elastic bands or exercise bands to help stretch and strengthen the smaller muscles in the feet and the ankles. So some of these exercises that I give patients that I just talked about, I give those out in the clinic, and we usually do that in the form of a stretch sheet. And if you're interested in the stretch sheets, if you come to the clinic, just ask us next time when you're in the clinic. If you don't, please just drop a message here that you're interested in these stretch sheets, and we will send one to you. So you can drop your interest in the chat here on YouTube or in the comment section here on Instagram. The recommended frequency and duration does depend on how much pain and discomfort you have and what type of condition. But generally, I recommend 8 to 10 repetitions of exercise first thing in the morning and 8 to 10 repetitions of an exercise just before bed in the evening. These are the best times to do exercises. First thing in the morning, it kind of gets you warmed up. It's easy to do because you just woke up. It's a priority. And then in the evening, just before bed, that's easy too because spending an extra 10 minutes doing stretches is not a big deal at the end of the day. Now, managing your pain at home, there's different home remedies and pain management techniques that you could do at home. One of them is ice and heat therapy. So for ice and heat therapy, I generally recommend ice when there's a new injury or there's a flare-up. So for example, if you just hurt your knee and it flares up, ice is better than heat. And I generally recommend 10 minutes of ice 3 to 5 times a day just to get the inflammation down. After the first 3 to 4 days, I generally recommend heat. The reason is heat softens the tissues, it increases the metabolism, the circulation of the fluid, and it makes it easier for us to do the treatment or the adjustments here in the clinic. So heat therapy can be good longer term. Over-the-counter pain relief options, there's many of them. Some of them are natural, and if you look behind me in our store section here, we have products like Tiger Balm right there, some other natural products that can really help with pain and inflammation that are over-the-counter. You can also get some medication if you go to the pharmacy. You'd have to talk to the pharmacist first, but things like anti-inflammatories, muscle relaxers, painkillers are some of the things you can find at the pharmacy to help you with your symptoms. Rest and activity modification are really important too. Most people will be less active if they have pain. They'll try and rest it anyways. But one of the things that I tell people is to elevate their leg if they do have pain. So try to get the leg above your heart. So if you can put a couple pillows underneath your knees, just draining the fluid from the leg back to the heart, that really helps. Just use gravity to help you. Rest, you should rest, but not too much. And I'll qualify that because if you rest the area too much, you're going to get atrophy of the muscles, and that's going to lead to weakness. So the first few days, getting some extra rest is important, but after that, working with a chiropractor to increase your range of motion and mobility and strength of the area is very important. As the pain reduces and your flexibility increases, you can do more and more activity, the pain will lessen, and we're going to get your body back to the way it was much faster. Now, when should you seek professional help? It's important to recognize when to see a health professional. Here's a few key tips for you. Signs that you require medical attention are persistent pain, pain that just won't go away, swelling like edema, inflammation, and redness, or the area becoming hot, shiny, or very tender. Now, as a chiropractor, We see patients with persistent pain, people that have a lot of swelling in their joints. Now, the redness can be due to bruising or injury, but if the redness is due to infection, that's something that needs to be treated either at the hospital or with antibiotics. So when you do have these symptoms, it's important to contact a health professional. A chiropractor would be able to diagnose the condition appropriately or refer you on to another health professional to help you with your condition. So here it says types of professionals to consult. I would consult with a chiropractor, physical therapist, orthopedic doctor, general practitioner. Those would be good people to consult with. If you're running a fever, I would go to the hospital and get checked immediately because it could be an infection that's spreading or becoming more systemic. Now on this slide, I'm talking about advanced pain management techniques. So when you come into the clinic, I just want to talk about or give you an overview of chiropractic treatments that we do in the clinic, as well as some other types of modalities that we have. So one of the things that we'll do for leg pain is assess the posture of the person, the way they walk, called the gait pattern. And then what we'll do is give the patient a diagnosis and begin treatment. The way we'll begin treatment is by doing adjustments to the knee, the hip, the ankle, the area that's affected. And of course, we want to look at the overall posture or alignment of the body. So sometimes when the hips are out of place, we find that the shoulders are compensating, they're out of place the other direction. And that's just to compensate for the imbalance in the lower part of the spine. Similarly, when people have, let's say, left knee pain, they'll be compensating by walking more on their right leg. So we can see compensation or imbalances due to these conditions in the joints. The point I'm trying to make is we really want to make sure we don't just treat the one spot, but we look at the body as a whole, because to heal properly, everything has to come together. Now, we do shockwave therapy in the clinic too. Shockwave is a sound wave that goes into the body, an acoustic wave that goes into the tissues to heal the tissues. It was originally designed as lithotripsy to deal with kidney and gallstones, but then it became more popular for joints or musculoskeletal conditions, and so we use shockwave therapy in the clinic. Very successful with things like rotator cuff syndrome, with bursitis, tendonitis, those types of conditions. Laser therapy has similar outcomes, but it's a light therapy. So it's a concentrated light beam that in two wavelengths, one to penetrate deeper into the joints and one to be more superficial. So laser therapy stimulates the mitochondria in the cell, which are the energy producing parts of the cell, and speeds up the healing and metabolism, releasing chemicals, reducing the time the patient needs to heal and get rid of things like inflammation in their joints. We do orthotics as well, and the orthotics we do and the orthopedic shoes are designed to correct for imbalances. Some of these imbalances can be caused by misalignments of the feet. For example, we do see people that have flat feet, or what we call pronation of the foot. And pronation is when the foot kind of starts to fall in. So you lose your arch and the foot becomes very flat. Or the opposite, where the arch is too high, that's called supination, and that can cause problems in the foot as well. So we do orthotics for a number of foot conditions like plantar fasciitis, like arthritis in the feet, like metatarsalgia, which is inflammation of the arch. There's a number of different conditions that we'll recommend for orthotics. And then the benefits and the potential outcomes of our treatment are to, number one, get rid of pain. Number two, restore the function of the joints. Number three, correct for any postural imbalances. And number four, maintenance and prevention, making lifestyle changes to support the work we did in the clinic. Now, there's a number of case studies that we have, or reviews and testimonials that are on our Google Google site. So I will put some links in the show notes for you when I'm done, but you can go and see the reviews, whether they're on Google or RateMD or Facebook. You can go there and see what patients have written about their joint conditions, and specifically for hip, knee, and ankle, foot conditions that we've treated here in the clinic. Now, here's some tips for you to incorporate some of these techniques into your daily routine. So to integrate pain management into your daily life, what I would do is start with adding one thing at a time. So start small. Begin with short, manageable exercise sessions and gradually increase duration and intensity. Incorporate these exercises into daily activities such as stretching while watching TV or doing heel raises while brushing your teeth. So some of these things can be very simple for you to do at home. Now you want to track your progress. So you might want to keep a journal or write in an app some of the exercises and activities that you're doing, and then celebrate your successes. So celebrate some of the small milestones that you were able to achieve with consistent activity. You also want to stay accountable. And a good way to stay accountable is either attending a clinic like ours, where we're going to ask you about your stretches and exercises, or have a partner who can help you to stay accountable. You could join a class or an online community for additional support and encouragement. The goal is to create a balanced lifestyle long term. And what I mean by that is eating a variety of nutrient-rich foods, including fruit, vegetables, proteins, and grains, to help support the healing of your tissues, healthy tissues. Stay well hydrated throughout the day, including using electrolytes to help with the recovery of the tissues. And then you might want to incorporate a mix of cardiovascular exercises, strength training, flexibility exercises into your routine. I generally tell people to do about 150 minutes of moderate intensity aerobic activity per week. Now, if you do 5 days a week, that would be about 30 minutes per day. If you're doing 6 days a week, you don't need as much. So you're looking at about 25 minutes a day if you're doing 6 days a week. And I generally say the more often you exercise, the better. So I encourage people to do more days than less, and just shorter duration. Rest and recovery is important. So getting enough sleep, 7 to 9 hours a day. Take rest days, like 1 day a week, to recuperate and recover from your exercise. And then manage things like stress so they don't interfere or derail you from your activity levels. So don't let stress kind of get in the way of a healthy routine. Now, I just wanted to know if you guys had any questions that you wanted to ask. I'm just going to check in the chat right here. And I'm going to check on Instagram as well. If you have any question, I'd be happy to answer those questions for you now. And sometimes people ask me questions like, how do we make an orthotic? Or, they ask specific questions about their conditions. And I would be happy to answer those questions for you right here. The orthotics that we do here in the clinic, we do orthotics from a foam cast. The casting technique is done here in the clinic, hands-on technique, where we do the impression of the foot. We write a prescription for the patient, and then we send that away to Toronto to get the orthotics made. They ship it back to us, and what we do is we are able to get the product in the clinic for the patient and then fit that orthotic properly in the patient's shoe. We also get orthopedic shoes, and orthopedic shoes are the whole shoe with the orthotic inside to help with the alignment and the function of the foot. So we've been using the orthotic group now for 20 years. They're an excellent company that helps people with their foot alignment and cushioning their foot and the function of their foot. Any other questions regarding foot conditions? Okay, now if you guys don't have any more questions, what I wanted to offer you is a special offer here to come into the clinic. So if you're interested in coming into our clinic, for a short period of time, we're offering you 10% off your initial visit. The way to get the 10% off is mention that you came to our webinar here on Instagram or on YouTube. You can use the coupon code WB10 for webinar 10%. And then you can enter that when you're booking an appointment online in our appointment calendar. So feel free to use this special offer until the end of the month to get a 10% off your first visit. Now, we do bill directly to insurance, including ICBC. So we deal with about 25 different insurance companies, including if you have a car accident with ICBC. And no doctor referral is needed. Today I went to the coffee shop just to grab a coffee, and the gentleman behind the counter was saying, do I need a doctor referral to come and see you? And I said, no, we're primary healthcare practitioners. You can come directly to us. We'll do the history, the diagnosis, tell you what's wrong, and then do the treatment for you. So no problem there. And usually we see people the same or the next day, so there's lots of flexibility in our schedule. We're open 7 days a week as well. So if you'd like to come in on a weekend, we do have appointments available on weekends. I want to thank you for joining me today for this webinar. We do weekly webinars here in the clinic. Feel free to go and subscribe to our YouTube channel, as well as you can join us here on social media. So please follow on Instagram, Facebook, TikTok, and X.